First, I'd like to thank Dr. Pevkianaki for inviting me to this conference and for allowing me to answer this question for you. The question that I understand is what's the difference, or should patients stay in their country for healthcare or travel to other countries where they may receive care as well? As director of the Eye Cancer Foundation, which has an initiative to teach local physicians in many countries how to care for patients in their countries, it is our mission to make local care available to most all patients. As the director of the New York Eye Cancer Center, I have direct experience treating patients from many countries and having them return to their countries for subsequent care. It's ideal to be able to not only treat patients, but also follow patients, because treatment is only the beginning of the journey. Many patients need subsequent interventions to maximize both their vision and their chance for life. And therefore, it is best if you're in a country that has a qualified eye cancer specialist to stay with that doctor who can give you the kind of care that you need. There's also financial issues. It's quite expensive to return to other countries for follow-up examinations. And oftentimes in those countries, the care is not necessarily covered by insurance. Therefore, the patient should consider that before they make their final decision on where to be treated. In addition, over the years, and I have been in practice for more than 3 decades, you develop relationships with patients. And that relationship has value because you'll be able to count on advice from your local physician and find them much more accessible. All that said, of course, there are unique technologies that are not always available in every country. So there will always be medical tourism or patients that are sent to other countries for those technologies. However, with time, we hope to populate all countries that don't have an eye cancer specialist and regions that don't have an eye cancer specialist, particularly for children with retinoblastoma cancer, where 70% of those children in unserved and underserved countries may actually die from their disease. I'd like to take a moment again to thank Dr. Pevkianaki for her invitation, and I look forward to participating in your conference.